Hello there.
Hey, good morning, Diane. Good morning to everyone. Good morning. Thank you for joining us. We'll get started in about 3 minutes, just allowing some folks to come on in. So thank you all for joining us. Anika, I have promoted you to a panelist. I don't know if you see that.
Okay, got it now, Damon.
Welcome. And then Dave, I've just promoted you to a panelist as well. There we go. All right, I'm going to go ahead and share my screen and we can get started. Can you all confirm? Can you see my screen?
Yes, we can.
Perfect. Okay, so welcome everyone to the school year 2022-2023 K-12 COVID-19 testing program. This is the official launch kickoff webinar. We'll do this one time. It will be recorded and posted within the next 1 or 2 business days, and we will also post a PDF copy of this slide deck for your reference, for your use throughout the school year. My name is Damon Hoyle. I am the Senior Operations Project Manager here at TEA, and I help manage one of the folks that manages the K-12 COVID-19 testing program, or the Reopening Schools grant, which we've broken into 2 grants. I'm joined today by some other colleagues from TEA and also from some colleagues at the Texas Department of State Health Services, who we are working in collaboration with on this grant. I'm going to go ahead and move to the next slide. But thank you all for joining us. We're excited to be here with you for the next 90 or so minutes. So as always, when we do any type of presentation, we have a couple of disclaimers. So I won't read this to you. I'm just going to give you a moment to look at the next 2 slides, which are some disclaimers that we have. And then this is the last disclaimer that we have. The long and short of a lot of this is in conjunction with the CDC, and this presentation or some content in this presentation, if new guidance or anything emerges throughout the year, is subject to change. But this, as of what you see today, is what is true and is in alignment with the grant and grant federal guidelines. All right, so our session agenda, we're going to quickly go over some norms and reminders. If you've been to these presentations before, you know that. We'll review what our objectives are today. We're going to then go through the background of the K-12 COVID-19 testing program. And that's important because we have people in various places. Some folks are new, some folks have been here since the very beginning, and then some have personnel has changed. So even if your district has stayed with us throughout these last 1 or 2 years, personnel might have changed. So we want to level set and make sure that everyone is on the same page in terms of expectations and requirements. We're going to talk about screening testing and use cases. We'll get into the actual content of the testing program logistics. And then once all that's done, we'll recap the highlights of the program, go over some quick important reminders. And then we have about 20 to 30 minutes, maybe closer to 20 minutes at the end for Q&A. Let me also say this about the Q&A as I move to norms and reminders. I'm gonna jump to number 3 and then I'll come back up. We have a Q&A feature at the bottom. At any point during the presentation, you can type in a question. Our panelists will help answer those questions throughout, but then we also have time at the end to verbally go over questions. And if someone needs to come off of mute at the end of the presentation to clarify their question, we will definitely allow that. But don't feel like you have to wait to the end. You can use that Q&A feature to ask your questions and we will answer them throughout. And if at any point we need to pause, my colleagues will say, hey, Damon, we have a burning question. Let's clarify that now. And we'll do that in the middle of the presentation. With that said, please keep your mics on mute. If we need you to come off of mute, we'll ask you to do so. At the end, if you have a question or you need to clarify, just raise your hand and we'll call on you. Use the raise your hand feature. And then use the chat feature. We ask that the chat feature, we'll be dropping some links there. And that's more for responding to prompts and so forth, or anecdotal pieces. But if you have a question, we ask that you keep that in the Q&A part so that we can kind of keep things aligned. And then lastly, this session is being recorded and it will be posted, like I said already, on our website, along with a PDF copy of this slide deck. And just engage. The more you engage, the more you'll get out of it. And once again, just thank you all for being here. All right, session objectives. So by the end of this, we want participants to be able to review the background of the school, of the school year 2022-2023 COVID-19 testing program, because some things have changed a little bit, expectations and requirements a little different. We want to be able to identify, like I said, requirements and expectations, not only the background, but the expectations moving forward. We want to look at some important upcoming dates and reminders, some webinars that'll be coming up over the next couple of weeks, and then give you time to ask clarifying questions. So by the end of it, these are the things that you'll be able to do. Now, throughout this presentation, myself and whoever else, one of my other colleagues from Dishes will be speaking, we'll be doing a lot of referencing to our website that we've revamped. So I'm gonna click here and then we're gonna drop the link in the chat for you. But this is our COVID-19 testing website. Here is where you can go. As you can see, we've updated it. We have all the way back to 2020, 2021. So if you were to click on each of these tabs, it takes you to the content related to COVID and our response to COVID for that year. Last year's links are here, and then this year's links are here. We do our best to update this website weekly or as needed, sometimes multiple times a week or day. And you'll see at the end of each link a date. That means that that's the most frequent or the most recent update that we've made to that particular link or that content. So we encourage you to continuously check our website because a lot of information is there. We will be pointing you there. We do our best to provide you resources. Another thing that I'll point out is that we've revamped it. Our media team and feedback from you all and from Dishes, we've gone through and tried to make it more user-friendly as possible. So you see FAQ and guidance. These links are already here for the current testing program, tools, templates, and resources, and we broke it down for you. So reporting forms will all be here. list. So that allocation sheet, the vendor resource sheet is here. The application, not only the online application right now, but the preview to the application. And then the CLIA waiver application and information for that is also here. And then we have some other resources we'll list here from the CDC and just other things that are related to this program. And then under webinars and presentations, we have all of our upcoming webinars, and I'll be removing some links as they expire. We'll remove those. And then recordings of the presentations and a PDF of the presentation slide deck is here. So upcoming webinars, the recordings of any webinars, and their slide deck. So all of that is here for you. This is updated, as I said, as needed, but typically weekly. So please check that out. I'm gonna go ahead now and drop this link in the chat. I definitely encourage you to bookmark it so that you can have it at the ready when you need it. So I've just dropped it in the chat. With that said, I'm gonna go ahead and move forward to our next slide here. So let's jump into the background of this grant once again to kind of reset everyone for that. And then let me go in. I see I need to give me a moment. Someone might have got knocked out. Let me just make them a panelist and then we will continue. I got you, Diane. There you go. You should be good to go now. Perfect. All right. So background of the grant. The U.S. Department of Health and Human Services invested $10 billion from the American Rescue Plan in 2021 to states, all 50 states, to enable school systems to establish COVID-19 screening testing programs to support and maintain in-person learning. So to keep schools open, they invested this amount of money. The official name of the grant is the ELC Reopening Schools Support for COVID-19. It's a long title here: Screening, Testing, Reopen, and Keep Schools Open and Operating Safely. That's the official name of the grant. If you were to go here and you click, and I'm going to click there, a hyperlink should appear. That's the grant. It was last updated about a year ago, but this is the official guidance. I know some folks are like, can we see the official guidance? It's here for you. And then from here, and I'll jump back into the presentation. From here, we then built the grant based on that guidance. So Texas, out of the 10 billion, we received $803 million, so around $800 million to flow through our state health department, which is the Texas Department of State Health Services, also known as DSHS. TEA then collaborated with DSHS because DSHS knows state health and they know the health piece and COVID and all of that. And TEA, we're experts in schools. So we came together to make these resources available for public and private school systems throughout Texas. And that's K-12 school systems. Now, this grant was first launched last year, the spring or summer of 2021, and it was a grant for last school year, 2021-2022. But then in March 30th of this year, the Center for Disease Control, CDC, announced that it would be exercising what's called expanded authority to permit an extension of these funds to be used for an additional year. So now these funds are extended through July 31st of next year of 2023. As a result, we got back with DSHS and we began to say, okay, let's extend the funds. Let's look at what went well this last year, what didn't go well, and let's tweak some things, but still stay within the parameters of the Reopening Schools grant. So that's why you see some things that changed. It's based on feedback. It's based on the successes and things that didn't go so well last year to make this the best possible grant that also aligns with grant guidance, federal grant guidance. So it is extended for a year. With that said, now, what I wanted to do before we go any further is there's often questions around, so we got the K-12 COVID-19 testing program, and then there's your school health support grant. What's the difference? And we sent several emails last year, had several meetings about the distinction. What happens is this: the $800 million we got is from the Reopening Schools grant. In order to make this best for schools and based on the need, we broke that $800 million into two buckets. So it's under one grant, but we broke it into two smaller buckets. The first bucket is what this presentation is on today, the K-12 COVID-19 testing program, which provides K-12 public and private school systems access to a group of vendors that have been approved by Dishes and TEA, 6 of them, for you all to receive antigen test, PCR test, and our staffing support. So that's the K-12 side of the grant. That's that program. The second half that we're not dealing with today, there was a whole nother webinar and training for that later for those who seek to apply for that. The School Health Support Grant provides eligible K-12 public and private school systems with access to needed funds to further support your COVID mitigation and prevention resources and activities. So there's a list of allowables. This year, there's about 8 of them. And this allows, if you apply to it, so these are 2 separate, under the Reopening Schools Grant, 2 separate grants or programs, and that you would apply to each of them because they each have different sets of guidance. If you were to apply for the School Health Support Grant, it allows you to get direct funds that come directly to you and your school district that you budget out and that you plan along those allowables that are listed. So those funds come directly to you. But in the program we're talking about today, the K-12 COVID-19 testing program, these funds don't come directly to you. There's a bank or a pool of money that we post on an allocation sheet. It never comes directly to you, but we keep an account for you. And as you spend and expend money on staffing support and testing services, we then deduct from that. And that's what lasts you throughout the year. So one of them you don't see is just on the allocation sheet. It is your money, but it's just there. The other one we send directly to you to spend according to allowables. So hopefully I did a decent job with that. Today, we're focused on this grant, K-12 COVID-19. Both of them have separate application processes and are kind of run tangentially, but also separately. All right, so back to K-12 COVID-19 testing program. The intent, want to really stress this because one of the things you'll hear us repeat time and time again is that we want to be responsible and be good stewards of federal funding. So the intent and the goal of the K-12 COVID-19 testing program is primarily focused on providing needed resources to implement screening testing programs. You will hear that a lot this year. This is in the grant guidance, federal grant guidelines. It's about screening testing programs to identify asymptomatic individuals and limit the spread of the virus within your school communities. Let me go further. Recipients should, whenever possible, align their testing approach with the CDC recommendations for grades K through 12. Here's another hyperlink for you. And when we send it out, you'll see it. It lays it all out for you. They also have the grant linked in here, and they have everything in here. And you will see a lot of this language in the application this year. And so we are very much so aligning ourselves with the grant. All right. So definition of screening testing identifies people, already I kind of said it, but I want to reemphasize it, who do not have symptoms or known or suspected exposures so that steps can be taken to prevent the further spread of COVID-19. So that's screening testing. That's different. And now some of this I know is me preaching to the choir, but to make sure we're all on the same page, that's why we're presenting it. This is different from diagnostic testing, which is intended to identify current infections in individuals and should be performed on anyone that has signs or symptoms consistent with COVID-19. This year's program is focused vastly primarily on screening testing. There is an exception when you can do some diagnostic testing. We'll get into that later in the presentation. But this year, the main focus is screening testing. You will see that embedded in your application, because in your application, if you choose to apply, you have to submit a screening testing program, or plan rather, and it's outlined for you. We guide you through the application. Now, I'm gonna now turn it over to my colleague, David Gruber, Mr. David Gruber, who is the Associate Commissioner of Regional and Local Health Operations, to talk about screening testing more in depth. Go ahead, Dave.
Good morning, Damon. Thank you very much, and good morning to all of you. I have a few slides here that discuss what actually screening testing means and how you might use it. Again, our focus is on screening testing, but as Damon mentioned, there are exceptions. So for example, if a student comes to school, exhibits signs and symptoms of COVID, you can test that student to see if that student has COVID. So again, there is some criteria for diagnostic testing, but the main emphasis that is in this grant, or the reason we are emphasizing it is because it is a condition that CDC put on us to administer the grant. So where does screening fall in? As you can see with the red circle, there are certain categories of testing surveillance, which is just overarching looking at large populations that may or may not have higher than normal exposure to COVID or may not be considered as high probability as having COVID. And that's just general surveillance among large populations. We already discussed the diagnostic, which is if someone is symptomatic or had a very, very high risk situation. They were sitting next to someone who had COVID for a period of time, or at home, the whole family has COVID. That would be diagnostic testing. Screening testing targets asymptomatic populations, those populations that are not exhibiting any symptoms, but targets those who might be carriers or carrying or actually having the disease without showing symptoms in order to prevent spread among your school population. So, for example, if you had a sports event going on, we've used this in the past, and you wanted to test the team prior to the sporting event, you're targeting a certain asymptomatic population with the goal of not spreading the disease among your team or another team, and allowing those and increasing the number of participants in the sport to make sure that they both have the opportunity, and also you have the best opportunity to win. So that's an example of screening testing, but there's different types of testing that go on, and many of you are aware of it. There's the antigen testing, which looks for pieces of the virus, the spike protein in particular, and it gives quick results, this antigen testing. It's on-site testing usually. It gives immediate results. However, sometimes the results do not give exactly what's going on. They may be negative, and perhaps there's positive among the individual, or they may show a positive in rare cases when the individual is actually negative. But in general, the antigen tests are a good way of testing and providing accurate results in general among a population. That differs from molecular testing or PCR testing, in which the actual test looks for the virus's DNA, the core of the virus. And that takes some time. There are some molecular PCR tests that can be given on site. Those are rare, and in those are not as accurate as the PCR test that got sent to a laboratory. And the reason why we say that it's always laboratory processes, we really don't necessarily recommend those on-site molecular PCR testing. It's better to do antigen testing and then possibly molecular PCR after that. But the molecular PCR testing is very accurate, because what it does is it looks for pieces of the virus's DNA, and in the laboratory it actually amplifies those pieces so that they're more easily detectable. And if you do get a positive for molecular PCR, you can almost guarantee it is a positive. There's another type of testing called pool testing, which particularly in schools has gained some favor. And what that does is it takes a whole bunch of samples from a whole bunch of people, puts them all in one, I'm going to use this just as an analogy, puts it all in one container, all the tests from everyone, and then tests that container. If the container's negative, then you can make the assumption that everybody's negative. However, if there is a positive of this pooled sample, then you have to go back and actually test individuals. So it can be used in many cases where the chances of positivity are low, and you're doing screening testing. And many of the companies that do pooled testing will take two samples from the individual. They'll take a pool sample for the pooled and then take a second sample. So if the pool is positive, they don't have to come back to your school or go back to individuals and retake the test. And in that case, it goes from a pooled batch sampling to individual testing. But again, if they've taken 2 samples, they don't have to come back to you. So I think those are the general categories of testing and the types of testing. So the pros and cons, I touched them on a little bit. Antigen is really good for people who are positive, who really are exhibiting significant symptoms. But most importantly, it's good because you can do that test on site and get results within usually 15 minutes or 20 minutes. And it is less expensive, as noticed here. And as I mentioned before, not as accurate as molecular testing. And if it's negative test, but the individual is symptomatic, it's very possible you might want to follow up with a molecular test to confirm that. We've had quite a few people who have had COVID who have been negative tested with the antigen, but do come back PCR positive. The molecular testing, again, that testing for the DNA, the RNA of the virus, I misspoke before. This is an RNA virus, is more sensitive than the antigen testing. If you get a positive from a molecular test, then you can pretty much bank that it is a positive. It is more expensive and the results take longer. It's not on-site testing in general. So, if you're looking for the accuracy, you want to go with a molecular test. And then the pool testing, it's a great way of testing large numbers of people, particularly if you don't believe there's this person with COVID. But if in fact, that pool test, that large sample comes up positive, you're going to have to test individuals. Next slide, please. So, just some examples for the testing of screening testing, again, to look for those who are asymptomatic and you want to catch someone who's positive but asymptomatic. We talked about the football team. We talked about our sports team. We talked about an outbreak that you might have on your campus or in your community, and you know that the COVID is spreading in the community and you want to test children before they come back on campus. Or you just want to test all your teachers on a routine basis. And again, using antigen testing is the quickest, most cost-effective way to do it. And you can follow up with that molecular. What you would not use screening testing for is just have people just sitting there waiting for people to come up and randomly come up to get tested. And it's just not cost effective and not necessarily public health effective to do that. Next slide.
Dave?
Yes.
I think that might conclude that piece. What we wanted to do, and thank you so much, Dave, for coming in. What we wanted to do is pause really quickly for about 2 to 3 minutes max to see if there are any questions, because we know the screening piece, we've already gotten several emails about it. We wanted to see if there were any specific questions about this that we can address for the next 2 to 3 minutes, and then we'll move on.
I do see a question in the Q&A which says, does TEA allocations include funding for both testing and vendor staffing? And the answer is yes. The grant, as Damon mentioned, does allow to support both the actual tests themselves and the vendor support for that testing.
Got it. Shannon, or anyone else that you want to add on? I see, or anyone else want to add to that? Thank you, Dave.
Just to answer the second part of that question about no cap on staff, there is an overall test allocation, and staffing is within that allocation.
So we've answered that one. And then I see a couple of hands raised. So I'm going to take these 2, and then we're going to move forward. Let me go to participants. I see one hand is raised. Go ahead. I just clicked. You can come off. Stephanie, you wanted to ask your question?
Yes. Hi, I'm Nurse Stephanie. I was just wondering, so what you're saying is that you are suggesting that we test only asymptomatic people?
No, I think the focus of the test is to prevent COVID from coming into schools. through the screening testing. However, if you do have an individual who's got the symptoms and is presenting in schools, you can use this testing program to diagnostically test.
Thank you.
Welcome. Thank you, Dave. All right, and then I see in the chat, so for screening testing, permission slips needed for staff and students, correct, each time or just once? I'm going to answer, and then Diana, if anyone else wants to jump in. You do, first of all, need consent. So you, and typically that consent needs to be done annually. I mean, you all are experts in school, so you know that. We do have those listed on our website. I'll make sure you all can see them. They're listed in last year's, but I'll move those permission slips over to this year. So thank you for that. But you would need it. Typically, you can get it and you can word it in a way to where it gives you consent for the entire school year. And you would need to do it every single time. So you cannot force a staff member to be tested. They have to, an adult has to, if it's a staff member, they're an adult, they have to consent to being tested. So you can't mandate it. And then for students, you have to get their guardian or their parents' permission for them to be tested. And that would need to be written form, whether you do it in digitally or written, but you need to have a record that you have, because you do not want to test a student and their parent is not aware or did not allow you permission to do so. So if we do not receive consent from a parent to do screening testing, but we have offered it in our plan, does that satisfy the requirement? That would satisfy screening. That wouldn't satisfy you testing a kid without their permission. This webinar, as I already said, will be posted afterwards within the next 1 to 2 business days, along with the slide deck. And then I'm going to let the panelists, if you all can, because I want to move forward for time, if our panelists can then go forth and answer questions within the Q&A chat. So as you all are listening, just open up your Q&A chat and you'll see questions that have been answered. They're going to type them in, and then any ones that are burning at the end, we'll come back to them. So for time's sake, I'm going to move forward, and then we'll come back to Q&A a little bit later. So notice for school systems in the city of Houston. So, and this is the same as last year. If you are a city of Houston school, and so let me just back up. The city of Houston also received funds through the same federal grant that TEA and that DISHES did to support a set of public and private school systems. So there was a list of some cities across the country, like New York, LA, Chicago, who got their own separate pot of money in addition to their states getting money. Houston was one of those. If you are a Houston area school and you're on this list, and this list is also available on our website, and your name, your district appears there, you need to reach out to the city of Houston, because they will then support you in terms of PCR testing. So if your name appears there, they will support you with PCR testing, PCR staffing, but you can access antigen tests from TEA/DISHES. So long and short, if you're on that list and you're a Houston city school that's on that list, you can come to us for antigen test only, but you need to go to the city of Houston for your PCR testing and so forth. And that list is on our website. It's also here. If I click on it, I'll bring it up really quickly. It's gonna pop up as a spreadsheet. It should. If not, if it's not coming up, I will, there it is. These are all of the schools there that are listed. So all of those schools, and it's public and private school systems. If you're listed there, Houston, the city of Houston has agreed and will be taking care of you all. With that said, let me move forward. The city of Houston sent me this slide. If you need further instructions or need more details from the city of Houston, this is where you can email. Email Houston Health Department at mail_us_ there. You can call them at this number, and then they have an FAQ. So definitely just check them out. These are all hyperlinked in this presentation, so when we post it, you'll have access to it. So if you have further questions, please reach out to the Houston Health Department. We meet with them weekly, and so we're aligned as well. So please reach out to them. All right, moving forward. K-12 COVID testing program. We kind of already touched on it, but just so you all see it, what does this program allow you to have? Access to antigen point of care testing, access to molecular PCR testing, access to vendor staff who can help administer those tests. So these are the 3 pieces of the program. Now, application eligibility. So this is also within the application. You first need to, if you want to be eligible for this program, you need to apply. We have an online application that has been launched. It's been up since July 14th. It was announced around that time. It is up there. Please go to it. I want to emphasize this, any private or public school system interested must complete it. It does not matter if you participated in the past. Everyone this year will need to reapply or apply for the first time because there's a new set of requirements, as well as we need updated information. So if you want to take advantage of this, please go ahead and apply. On our website, we've also provided a preview of the application. So if you want to gather your material or review it before you decide to apply, we have a PDF copy of the application listed for you. So once again, try to do our best in providing that resource. Number 2, screening testing. We've already said it. It's a screening testing program. You must submit in the application a screening testing approach, and it's broken down for you. Only K-12 schools. So this is a big one. We emphasized it last year. There's not a change here. This is for K-12 schools. Now, if you are a pre-K or you have daycare or your early childhood center, but in your building you commingle with K-12 students, then you are eligible for this grant. So for instance, if you worked, I know I used to work at KIP, we had pre-K 3 through 12th graders. They would be eligible, those pre-K kids, because they were on campuses with K-12 students. But if you are a standalone pre-K center or a standalone early childhood or daycare center, then you would not be eligible for this grant, and you would need to seek funding elsewhere for those kids. Closeout reports. Many of you have gotten emails on it. It's listed in the TAA, but there are a list of closeout reports that you need to have submitted if you participated last year so that we can reconcile what you have on hand for this year. So public and private school systems that participated last school year must have completed all of it. Now, some of you might say, well, we did complete it. Yes, you might have completed it, but what you submitted and what we have on file with dishes doesn't reconcile. So we'll be reaching out via email to either set up a meeting on the phone, via Teams, or email back and forth to get you reconciled. We've been doing a lot of those this week. And then lastly, guidance document. All eligible school systems must adhere to this guidance document. It pretty much lays out everything we're covering today, but in a way more detailed fashion. Table of content, it's about 8 pages. Please review it because this is what we're holding ourselves and all schools accountable to this year. So that is eligibility. Participation requirements. A couple of things here that have not been mentioned. Every school, public or private, that chooses to participate, similar to last year, you need to identify key personnel. There are 3 that you will be asked to identify on the application. Number 1 is your testing coordinator. That's the main person who we will contact, who is running the show for you for this program. Then an alternative test coordinator. In case your school system is large and you need 2 people to do it, that main person is out, they leave, what have you, you have a backup person. And we also need a superintendent, district official, headmaster listed. That's because, and that's trying to contact folks, sometimes we need to contact all 3 or the superintendent and the test coordinator given the situation. So please give us all 3, make sure the information is accurate. And it is, this last piece here, it is your responsibility of a school, and you guys have been pretty good about that. So thank you, to let us know if things change. If someone leaves, if someone switches positions, you want to add someone, let us know. We don't have a problem with adding them to the listserv. But we do need to have appropriate and up-to-date contact information. State-approved vendors. You would use our 6 state-approved vendors, and that's listed on here. I'll show you who they are later. Many of you are already familiar, but you would use these approved vendors. Not opening it to any other ones. These are the 6 we are with to the end of the school year. If anything were to change, we would let you know. Allocations. School systems will be eligible to receive a funding allotment based on, and this is based on your population, which is why we asked for it in your application. So this is based on total staff and total student population. We have a formula that then spits out a number based on that population. And then that amount of funding allows you to receive that amount of testing. So it's done based on population need in terms of size. And then let me go further here. TA will update. So we update this allocation spreadsheet for public and private. The list is kept separately. We update it as of now every Monday and Thursday based on as you apply and based on as you report results and expenditures. It'll be updated with new names as you apply, and then you will see percentages and numbers change as you use your testing services or staffing. If it changes from Monday to Thursday, we will let you know, but right now, close of business every Monday and Thursday, you'll see it up there. Proper storage. you need to make sure that you can store these tests in the proper temperature controlled setting. We would hate for you to get a bunch of tests and then they're no longer good because where you're holding them is either too hot or too cold, and now the tests are now ineffective. So please make sure you read the use of instructions, which is all on the vendor resource sheet, to make sure you have proper storage and temperature controlled. And then lastly, fiscal stewardship. I talked about it, I'll repeat it throughout, you'll hear it throughout the school year. We want to make sure that we are good stewards and we're vigilant of federal funds. We want to make sure that we're adhering to the grant guidelines as closely as possible. So you're going to hold us accountable, we're going to hold you accountable to that. And so that's why we baked in some new requirements and changed some things up this year. Now, with that said, COVID testing requirements, we already talked about it, screening testing, develop it, make sure it's aligned with the CDC. You'll put that in your application. It's already said for you. I won't go further into that. Now, according to the CDC, COVID testing requirements are as follows. A minimum screening testing should be offered to students not fully vaccinated. At any level, it should also be offered to all teachers and staff who have not been fully vaccinated. I'm reading the parts in orange. To be most effective, and this is just a best practice, the screening program should test at least once per week. Doesn't mean that will always happen, and that is best practice. Screening testing more than once a week could be even more effective. Schools may consider multiple screening testing strategies, such as pool testing. Schools can routinely test student athletes. We mentioned that already, participants, coaches, trainers. That's another good one. And then schools should consider implementing screening testing of participants 24 hours before a major event, or if you're taking like an end of the year trip, a field trip, 24 hours advance, at least. That way you're not doing it so far in advance where they might catch the virus in between. So you want to do it as closely as possible to the event. So that's here for you to read in more depth. I won't go into more detail there. Now, this is where I wanted to really get to. Reporting requirements. So for any grant, there's always reporting requirements. So school systems must follow all reporting requirements outlined below to adhere to the federally funded CDC grant. Failure to submit timely, accurate reports will result in removal from the testing program. That means this: we're going to work with you. We know situations and things happen, but if there's a continuous pattern of just not submitting things over and over again after the guidance, then we will have to have that conversation about this might not be the best program for you. We're not looking to do that, but we needed to put that out there because it could be a possibility. So the first testing requirement for this grant is the Test Services and Received Report, TSRR. Anybody that was a part of the program last year, you're familiar. Must be submitted 48 hours after receiving your products. So let me break that down. You order from a vendor, you get your testing, you get your antigen test on a Tuesday. We need to know that you've received those tests by that Thursday. The reason we need to know that, or your staffing support, is because this helps dishes reconcile invoices. When the vendors send in the invoice, say, hey, we administered and rendered these services, they send us an invoice, we then reconcile what you reported to make sure that it's equal. Because sometimes what they submit and what you submit are different, and we got to get to the bottom of it to make sure the proper money and the funding is going out. So that's why we have this report. So 48 hours after receiving it, or if you're getting staff, it would be, and here's the chart for you. So if you got a staff member Monday, Tuesday, Wednesday, you need to report by Friday in your TSRR. If you did staffing for a whole week and you finished on Friday, then by the following Monday, we need that staffing report submitted in the TSRR. And then let's say you did staffing Monday, Wednesday, then you would submit your staffing report Wednesday, Friday. So let me show you what this report looks like. This is also posted on our website. It's right here. It lists the instructions for you at the top. You would choose public or private. I'm just going to choose a random school. You'll put in your authentication code. If you don't have it, it's the same as last year. They don't change. If you need it, email us. We'll send it to you. Email COVID case. You put your name, your email address. You choose the vendor you chose, and then you answer a series of questions. The quantity of antigen test. If you receive PCR, the quantity of PCR test, how many are expired. And if you chose staffing, you click in here and you type in that information. This is what you will do. This will be one of your most frequent reports. Every time you receive products within 48 hours of staffing, you need to submit this report. When you don't submit it within that time frame, then we email you, and then there's that whole piece there. So just bookmark it, make sure you are submitting it. So that's the first requirement, reporting requirement. The last three, test administered and results reporting. So once you receive your test and you begin to administer those tests, we need to know that. And where you're going to submit it is in your vendor portal. Every vendor has their own reporting portal. And what you're going to submit is the number of tests that were administered. So let's say you administered 100 tests. You would say 100 tests. How many exclusions there were? If there were 10 exclusions, okay, you submit that. And then out of that 90 remaining tests, how many were positive? We just need to know that number. We're not asking, it does not ask you for any personal identifiable information, but we need to know how many tests you actually administered, the number that were excluded, and how many were positive. This will be put into your vendor portal. They then send that over to us, and then that's how we track usage. So if you say, well, we only have 10 tests left, well, that doesn't reconcile with what you've reported to your vendor. That's where the issue will be, and we'll say, hey, you need to go back and report tests, because what you're saying you have versus what you reported don't reconcile. So what you report is what we know, because that's what the vendors give dishes and gives TEA. Best practice is to submit it within 24 hours, right? You test on a Monday, get it done by Tuesday. Now, we know things happen. At the latest, get it done by Friday, close of business. What we've seen is the longer you wait to report these tests and the results, the less accurate they can be. You might lose the paper you're tracking it on. You might lose, something might get deleted, coffee spilled on it, things happen. So the closer you can report it to when you administer the test, the better and the more accurate. The last two, so that's your second one. Your first one was the TSRR. When you received it, let us know for the invoices. The second one is your administration usage and your results in the vendor portal. The third is grant programmatic surveys. We might send you a survey asking for feedback or something additional. We need you to adhere to that and respond. We're not asking just to be asking, we're asking because it's a part of the program and we're trying to change, tweak, or be better informed as the managers of the grant. And then lastly, school systems must report any additional reporting. So that's like that inventory report. At the end of the year, we're gonna ask you how many were expired and how many you have. If we ask you that, we need that because we're trying to make sure our numbers are aligned, okay? And this does not remove you from reporting to your local health department. You still would need to do that. So you would still do that as well. So these are the four main reporting requirements. They're listed in our guidance document. They're also in the application, and they also are here. So it's in multiple places. Lastly, failure to comply with reporting requirements of the grant may lead to a delay in receiving your future test. So we will pause you if you have an outstanding report. It could freeze your allocation. And if it just becomes so egregious, then we would have to move forward with what we don't want to move with, but we would, which would be removal from the program. So these are your four main reporting requirements.
Hey, Damon, real quick, there's a couple questions as far as what does the excluded mean in that top bullet of that previous slide, sir?
Got it. I will, you know what, I'm gonna let our health experts, Diane or Shannon, do you want to talk about exclusion tests?
Sure, this is Diane. So an excluded test would be like if you give a swab to a kid to take a swab of his nose, and instead he sticks it in his mouth. Well, he's ruined that test. So that's an excluded test that needs to be recorded as excluded or ruined. Another example would be if you're going to test and you accidentally drop the swab before you can get it to the nose, then that would be another example of an exclusion, and those need to be recorded. So when they're ruined or you can't use them because something happened, then you need to record them as excluded in the vendor's portal.
Thank you for that. And Brooks, thank you for that interjection. Thank you, sir. Thank you, Diane. Allocations. So allocations. So this is how you're getting your money. This is the formula, or not necessarily formula, but this is the thought behind allocations this year. Schools must have a screening plan that supports their district's needs. Schools must only order what they intend to use in a month. The reason we do that is we're trying to prevent stockpiling. We don't want you to be sitting on thousands of tests, but they're not used, and then they just sit there, and then they might eventually expire. There's a limited supply of tests per vendor. And so we want to make sure that we're sending the right amount to the right schools and that we just don't have unused tests sitting that could have been prevented. Last year, on average, school systems tested about 3% of their total district population each month. So based on that and some other numbers, that's kind of how we developed the formula this year. There is a public and a private schools list for allocations that I'll click on and show you in just a second. Once again, the allocation sheets are updated Mondays and Thursdays as of now. It might be subject to change if needed, but right now, Monday and Thursday, if I close of business, click on it and it'll be there. Make sure you refresh your links every time. Just press the little refresh button, because if you don't, old information will populate. And then lastly, before I click on the allocation sheet, your initial order. That means for this school year, once initial orders are placed and received, no further orders will be allowed until a minimum of 80% of that current testing supply has been reported. Once again, you have to report it to us as used through the results reporting. So let us know what you've used, and then we'll base our updated allocations on that. So 80% every month when you order, or once you order, once 80% is used, you can then order again. If you use that up within a month's time, great, or quicker, okay. If it takes you 3 months to use 80%, then that's just what it is. But we want to make sure 80% of what you have in stock has been used before we can then issue further or allow you to order further tests. And then once again, that prevents stockpiling. Let me go ahead. I'm going to show you an example of the allocation sheet. Diane, Brooks, anyone, feel free to jump in on here if you want to add or clarify what I'm going over. So this is the allocation sheet. I clicked on the public one. It was last updated 8/1. I'll refresh my screen because I'm going to go here and refresh the screen to make sure. And when I click back on it, 8/1 is the most updated one. So what you want to focus on is what's in green, because this is the max testing allocation increment. That means for right now at a time, this is what you're allowed to have. And this is the dollar amount that you have access to order. Now, I'm going to use Carrollton Farmers Branch ISD as an example. They're in black. That means right now they can order testing and staffing. And the reason why is because they've taken the staffing training. Anyone who wants staffing has to take that training, which is on Fridays. They got credit for attending it. They don't have any outstanding reports, and then they don't have any carryover or any testing stock where 80% had been used. So that's their $1,400 that they have access to. They have a total of 1.3 for the year, $1 million for the year. And as things go forward, we'll populate this with their reported expenditures. So as they use their dollar amounts, it'll populate here. You'll see an updated dollar amount here of what they have left in their account. You'll then see percentage of the allocation used. So as they use it, the dollar amount and the percentage of what's used will populate. Staffing expenditures, how much if they choose to have staffing that they've used, and so forth. And it goes on from there. Expired, received, all of that's here. And this is all about what you've reported to us. Now you will see, and in my next slide, we'll get into holds, but I'm gonna talk about it now. If you're in blue, that means you have a carryover hold. What that means is you still have tests on hand from last year that are enough to carry you to where you don't need tests right now. So your dollar amount, this allows you to order staffing if you choose to have it, but you could not order tests. You can only order tests when your name is in black, because that means that you've reported 80% of your current piece used. Now, let me go over here. Your name will populate as you apply and your application is approved. If you're in black, you can order testing and staffing. If you're in blue, you can only order staffing. In order to order staffing, you have to have attended a Friday mandatory staffing session if you want staffing. You don't have to have it, but if you choose to have it, you have to attend. We do the training, we give you credit for attending, and you get a yes there. This is all visible to our vendors, and they've been trained on this sheet so that they then know when you call them or email them, they know where you stand and what they can be able to provide you as a service. And if they have a question, they might answer it or they might send you back to us. So let me pause there. Do any of my colleagues want to clarify, add on to the allocation sheet?
Damon, this is Diane, and I would just like to clarify on the example that you used for the school with a 1,475 allocation, that allocation is for tests only.
Yes.
If they want staff, they can get staff, but that staff is not going to come out of that $1,400. So that $1,400 is only for tests, but
Got it.
staff
Thank
is also an option.
Got it. Thank you. Thank you for that clarification.
Mhm.
One other additional clarification on that, as it regards to staffing, Damon, is like the staffing doesn't come from the max testing allocation increment, but the staffing will still draw down on their overall 22-23 allocation.
Thank you. I knew I was gonna. So if you, as you order to what Brooks has said, thank you. As you order staffing, you will see that deducted from this column here, right here that I'm pointing to. Thank you both for that clarification. All right, I'm gonna move forward. Holds, I already kind of touched on them. To adhere with the CDC grants requirements and ensure proper federal funds of spending, it may be necessary for TEA and DISHES to place a hold on a school system. These holds are not necessarily punitive. They're not punitive, but they are a way for the state agencies and school systems to better monitor spending and equitable usage of grant funds. So once again, we can be responsible stewards of federal guidelines. So there are 4 types of holds. The first one is the test services and receive report hold. I showed you all that reporting document earlier. If you haven't reported within 48 hours and we give you some time, if you pass that threshold of reporting, your account will be put on hold until we get it, because we want to make sure that what you said you received thus far reconciles with what the vendor has said. And if we can't do that, we don't want to issue additional tests, allow you to get additional tests, because we really don't know what you have or things aren't reconciling. So you would see a hold on the allocation sheet. Reporting hold. The school system has placed an order and has not reported usage of 80%. So once again, you ordered 1,000 tests, you've only reported 500, you would be placed on hold because you still have 500 tests left. Once you report having used of 800 of those, which would be 80% of it, you would then be able to order more tests. Next one, staffing hold. This is only for those who apply for staffing. Staffing is completely optional. You don't have to do that with this grant. If it is determined that school systems are not adjusting staffing requests based on testing demand, the school system will be put on a staffing hold and unable to utilize the vendor's staff until resolved. Let me give you a quick example. If we're seeing, we get an invoice from the vendor that X amount of dollars have been used, and then we look at what you've reported or what's going on, and we can see that maybe the approach isn't the most efficient, we then will put you on a hold and ask further questions and ask to see a staffing log and so forth. We want to make sure, because most of these vendors have a minimum staffing number of hours. They might have to come for 4 or 6 hours. We want to make sure when they're on your campuses that they're actually working and administering tests and not just sitting around. And if that happens multiple times and we see that money is not being properly used, then we want to talk. All right. We know that things aren't going to be perfect and you need time to adjust. But if there's a question at hand, we're going to pause so that we can dig deeper to make sure things are effectively being administered in terms of staffing. And then carryover. The school system has efficient tests from last school year. So this is really for the beginning of the year, typically, programmed to cover their current needs. So if you have a bunch of tests left over from last year, then you don't necessarily need new tests because you have enough to cover your staff and student now. Once you've reported 80% of what you previously had from last year, you'll be opened up to get new tests. And at any time you have a question, email COVID case, we'll get back to you. DISHES has also been a great partner in this to also help respond to these inquiries and reporting. All right, so I'm going to move forward. Testing allocation process, covered a lot there. Let me sum it up here. You order your test. The vendor then ships you the test and or staffing if you want staffing. Once you get it, you submit the test services and receive report within 48 hours of receiving it. That way we know that helps with the reconciliation of invoices. You then administer those tests by either with your staff or staff designee, or you let a vendor staff do that. You then report after you've administered your test, you report how many you've used, you report the number of exclusions and the number of positives. And you do that in the vendor portal. That's where that goes. You constantly are monitoring your usage of tests to make sure what your screening testing plan is a fit for the demand in your school community at the moment or during that time period. And then lastly, once you've used 80%, you reorder your next increment, and you can look at the allocation sheet to see what we have documented for you. If at any time the allocation sheet in your mind doesn't reconcile with what you have, email us. We'll dig deeper and get your numbers reconciled or confirm what's going on. So that is the allocation process. Now, I mentioned a bunch of vendors, or I mentioned vendors quite a bit. So wanted to make you all aware of a change this year. Vendors that are currently offering staffing support are as follows: Quest Diagnostics, Goodside, Achieve Health, Bloom, and AccuReference. They are still offering staffing services for the 2022-2023 school year. Thermo Fisher is no longer offering staffing this year. So that is a difference. So if you go with Thermo Fisher, you would then be saying that you yourself, your school district or designee, because you can train a parent, volunteer, other folks within your school community, as long as they've been trained, they can administer. So that's why we say designee, then they would have to do that. Now, if you are a school district and you participated last school year and you have Thermo Fisher carryover tests, you got 400 tests left last year that you ordered from Thermo Fisher, that's fine. We've met with Thermo Fisher, and this is also met with other vendors. Some of our vendors have agreed that they will, if you need staffing for your carryover, your test from Thermo Fisher from last year, some of the current vendors for staffing have said that they would send their vendor staff to come in and help administer the Thermo Fisher test. Let me be clear with what I'm saying here. This is only an option if you have carryover Thermo Fisher test that other vendors would send staff to administer. Any test you order for this school year, you yourself would need to administer, but we want to honor your carryover test because that's from last year's program. Okay, so that's the difference here. If you are in that situation and you need your old carryover test to be administered from Thermo Fisher and you want another vendor to do that, email COVID case, we'll connect you with dishes and we'll coordinate which vendor is going to do that. And then our vendor resource sheet is here, and it has a bunch of details. It should pull up quickly, and then I'm going to move on. This is our vendor resource sheet. I've mentioned it quite a few times. At the top, you will see all of the vendors, AccuReference, Achieve, Bloom at the top. And then as you go below, you'll see the different parts: vendor statement, CLIA, rapid tests, analyzer, all the other information, staffing notes, and so forth. And then there's also usage and other pieces, lab notes and other information you need. And then their contact information is there. So please, 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 we update this as frequently as we need to. Please adhere to what's on this sheet or use it to refer to as you begin to reach out to vendors, because a lot of information has already been provided for you. I will now go back to the PowerPoint here. I'll go through this pretty quickly. All this is saying that is if you order vendor staffing, and let me say this, if you want vendor staffing, once again, every Friday from 1 to 2, and it's on our website, we have a recurring training. You would have to go to that training, stay the duration of the training to get credit. So in order to get staffing, you have to go through that training, and we go into the deep details of what staffing is. I'm not going to do that here, but I'm just giving you a brief overview. These are the things that you would have to meet. You would have to have applied to the application, indicated that you want staffing, submitted a tiered testing plan in the application. You have agreed that you're going to use this staffing log. We go into more detail in that training. You're going to agree that you're going to keep that internally, and that you're going to make sure that when you have vendor staff come on your campuses, that they're actually being used throughout the entire hours or time frame that they're there, so that we can be good stewards of federal funding. And so that training is required if you want staffing. If you don't want staffing, you don't go to that training. It's every Friday from now through the end of September, and then after that as needed. So that's that. Sum this up for vendor staffing. Review the staffing expectations and requirements. It's in our guidance document. Determine if you want vendor staffing, which vendor staffing support or which vendor fits your need. Price point, hours, all of that. Submit your screening testing plan in your application, and you apply. Once you've been approved and you have that little yes next to staffing on your name on the allocation sheet, you then would begin to reach out to the vendors, order your staff, track your staff internally on that log, submit your TSRR. So after every time a staff member, they finish for the day or for the week, you're submitting their hours in that form electronically, and then just continuously monitor your staffing support to make sure that that it's most efficient for your campus in terms of economics, in terms of the money that you're expending, and it fits within your screening testing plan. Okay, so that's the vendor staffing process. Once again, if you want more details, come to a training. You only have to go to it one time, and you're given credit for the year. Now, covered a lot there. So kind of let's recap, and then we're going to open this up for questions because I'm sure we have quite a bit. Key elements of this COVID-19 testing program. I want to review those now. The first thing is review the guidance document. I'm going to click on it again. Read through this document. It's also, a lot of this is in the application. Read through it and make sure that you can adhere to it and that this is something that you can do. Or if you have questions, email us, ask us questions, review this PowerPoint. Once we post it, review this recording. But make sure that you're familiar with what's required, because that's what we're going to hold schools accountable to. That's what we're holding ourselves accountable to. Number two, have a tiered, if you choose to move forward, have your tiered screening testing plan, have it developed, talk to your folks, make sure it aligns with what you say you can do for your school community. Once that's done, submit your application. Say, hey, we can do this, we have our plan, let's go ahead and submit. Once that's done, and we have it, and your name appears on the allocation sheet, you will also, after you apply, you will receive a notification that says, congratulations, you have been approved, move forward, or you will receive a notification that says, hey, your application is still pending because the inventory report, we don't have it, or what you submitted in the inventory report wasn't accurate, or the testing plan you submitted was not robust enough. We are reviewing these thoroughly, and we want to make sure that what you submit is actually accurate. Once you get that approval letter and you see your name populate, you can then reach out to vendors of your choice and do that. You'll then administer your tests, report usage and results, and then continuously monitor your testing program. Make sure what you have in place makes sense for your school community. And that might change throughout the school year, okay? Lastly, before we jump into questions, you can work with more than one vendor. If you choose to work with more than one vendor, you are responsible for reporting to all of those vendor portals individually. So I just wanted to let you that. If you expand the number of vendors, you're expanding your breadth of responsibility. So before we jump into asking you all your questions, we anticipated some already. So I want to get into that now, and then we'll open it up. Do we have to use tests in a specific way or on populations? We've already answered that. Yes, screening testing, you can see it there, including recurring testing for asymptomatic individuals. School systems will need to develop and submit a screening testing program. Can the test be used during outbreaks or for symptomatic individuals? So this is that exception. Yes, you can use these testing supplies for that. If a student or staff member becomes symptomatic while at school, or the on-site resources for the screening testing program could certainly be extended to test that student or staff faculty member. But it should be noted, however, that students or staff who are symptomatic should not be coming to schools. We know you can't control what parents do, but please communicate this. If they come to, they shouldn't be coming to school symptomatic. If they are symptomatic and they know this before they come to school, then they should seek COVID testing at clinical care sites or existing testing sites within your communities. This is another big question that's come up. We are not participating this school year. However, we participated last year and we still have tests. Do we need to return those tests to you, or what do we do with our tests? No, TEA and dishes nor vendors will accept unexpired working tests. Now, if there's a faulty with your test or something, that's different, but we don't want unexpired working tests. You would keep those tests, and you should continue to use those for screening testing or to test staff and students as they become symptomatic during the school hours, if they become symptomatic or in an outbreak situation. You will still, even if you don't participate this school year, if you have tests from last year and you're using them this year, you still have to report those tests. You still have to, because that's still from grant federal dollars, and we need to know those results. And so you still need to report those to your vendor portal. And then lastly, can COVID tests we order be administered by multiple vendor staffing support? No. The test you order must be administered by that vendor. You order AccuReference staffing has to administer those tests. Any COVID tests can be administered by a school staff member though. You can administer your test, or you can designate someone in your school community as long as they've been trained and they sign off on it, a parent volunteer, someone like that, they can also administer. The only exception is Thermo Fisher carryover tests from last year. School systems can reach out to us and we'll help coordinate your Thermo Fisher tests from last year and which vendor can administer those. But outside of that, who you order from, you order staffing, that's who has to administer those tests, and or you yourself. Last thing, we're gonna jump into these questions. We got some upcoming webinars. These are all on our website. The recurring staffing webinar training will be every Friday from 1 to 2. You'll get credit once you come. Those are not recorded, but we do send you the PDF afterwards. We do track attendance and we know how long you stayed. You have to stay the duration of the training to get credit for it. And then your name, a yes will be by your name on the allocation sheet. These other 6 listed webinars, we did it in the summer, but we're doing a fall version or a beginning of the year version. Every vendor will do an additional vendor webinar the week of August 15th. These will be recorded. Those slide decks will be posted, but it gives you an opportunity to ask live questions that you wouldn't necessarily be able to do at the beginning of the year. Those are not mandatory. They'll be posted. You can go back and review them, but we're offering it to you as a resource. So feel free to join them. You can go register for those today. If you want staffing support and you want to come tomorrow, go register today. We'll be presenting from 1 to 2, if not next Friday and moving forward on Fridays. Lastly, good standing schools. A good standing school is the following. You are always submitting your TSRR reports. So you're constantly letting us know once you receive your testing services or your staffing reports, and you do that within 48 hours. Vendor staffing reports. If you have a staff, you're logging and tracking your staffing. And you have that. That's a school that's in good standing. Inventory closeout survey. Your inventory closeout survey from last year is not only submitted, but it's accurate and aligns with what we have on file. And then lastly, I won't get into the details of this. If you worked with outside vendors last year, that means you took money from the school health support grant and you worked with vendors that are not our 6, then you've reported those testing results. You would have gotten an email already from our grants department on that, and we've been responding to those emails. If you want to stay in good standing, these are the things that you need to do as a school system. With that said, I've done a lot of talking, so I'm going to pause here now, and we're going to open it up for Q&A for the next, for the next 21 minutes. So I'm going to first go to the Q&A feature, and then we'll move over to the chat. And Diane or anyone from Dishes, if you want to jump in, feel free with questions. So the first question, and if you need to see the questions, if you click on the Q&A feature at the bottom or top of your screen, you'll be able to see what we're seeing right now. If a school district conducted screening testing on a group of employees only, no students, would that meet the screening requirements of the program? So I'm going to answer this and then let some folks jump in. Actually, Diane, do you want to answer that? Or Shannon?
Can you repeat the question? I'm sorry, Damon.
No problem. If a district conducted screening testing on a group of employees only, not students, would that meet the screening requirements of the program?
I mean, it would technically, since it's a targeted screening. But I mean, the questions that we would ask, is that really going to give you the information that you hope for? I mean, why? I would ask, why aren't you going to test any students?
Yeah. And one thing I would add to that, and then anyone else can jump in, is if you plan on testing students, then that also needs to fit within screening. But if you only want to test staff members throughout, then I think that we should be fine there. But it would need to align with what you submit in your application. We will review it and approve it anyway. So, or ask further questions. So that's that, unless someone else wants to jump in on that question. All right. Next one, how do you know where you stand or what needs to be updated? So a couple of things, you can just flat out email us and we'll tell you, or you can go ahead and apply. And when you apply, we will respond and let you know. So what happens is, if you currently don't know where you stand with inventory reporting or reports, if you're in good standing, go ahead and apply if you choose to participate this year. And then we would respond and say, hey, you're good to go, or hey, we need more inventory. We need to reconcile your inventory report or something like that. But if you just want to know, you can email us too, and we'll let you know as well. So that's answered. If daily self-screenings are part of our mitigation protocols, can that be part of our screening plan, or do we have to do active screenings? So I'm gonna lean on my dishes colleagues here or someone else, just because I want to make sure the answer is accurate. So I'll repeat the question, and Diane or Shannon or whomever, you can answer. If daily self-screenings are part of our mitigation protocols, can that be a part of our screening plan, or do we have to do active screenings?
So I'm not quite sure what daily self-screenings mean, or what an active screening would mean. I'm confused. So if it's, I'm thinking it's like an at-home test or not, but Robin, if you could provide some clearer information on that question.
Yeah, that would, okay. So Robin, if you can just add something, or we might have you come off of mute in a few. Juanita Molina, I think, I'm not sure if this is a question, looks like it's just a statement. In each box of test kits, there are positive and negative test kits. It wasn't presented as a question, so I just read it. Martha Norris from Galveston. What if we develop a screening plan, but no one participates? What happens then? So a couple of things I'll answer, and then someone else can jump in. So if no one participates, then you could use, and this is a slippery slope, so I want to make sure that, because this would be the exception. If you order tests, you have them on your campuses, and folks, there's a low turnout for screening testing. As folks become symptomatic, you could use this to do that testing, but once again, that's exceptions. If they're already symptomatic prior to coming to school, they should be seeking testing outside of the school. So you could still use your test. Does anyone want to add to that? Someone wants to know, once again, if they put forth a screening plan, have every intention to do it, but then their staff and students don't participate or don't come out in a high number, what do they do?
Yeah, so that is always the concern, is especially when you're trying to figure out your plan, whether you're going to need vendor staffing or not. It's always best to prepare in advance to get those consents, in particular from the parents, so that when you do want vendor staff to come out, you know possibly how many children to expect to be tested there. And then you'll use your request for how many staff you want, how many hours you want them there, and that kind of thing. So getting consents first is very, very important.
Thank you, Diane. Is there a specific screening for the grant requirements? So if you look on our website, if you were to click on our guidance document, or if you click on our application preview, or in the application, we have links to the CDC webpage, and it lays out what screening testing should look like. We also give you a little bit in the application, but it outlines what screening testing is and what that should look like. Examples are, you can test a football team before or the third grade students every other week, or your 8th grade stats teachers or something. It's asymptomatic. It's screening of a specific population that is asymptomatic, so that you can identify who might have the virus and respond accordingly. How to find out if we use support grant money to purchase our COVID-19 testing program. So if you just email us, we'll let you know. We have a list. We have all the applications tracked, and we have a list of if you've participated. Typically, the test coordinator might not have applied, but someone in your finance department did. And so sometimes that communication is not always seamless within a district. So if you just reach out, Kimberly Dans, we'll let you know. We will only be testing from one location, not on each campus this year. I do not foresee students attending our screening opportunities, but only using this program for symptomatic exposures. If this happens, will it create a problem? So Diane, let me get your thoughts on that, or Shannon, I'll reread it. We will only be testing from one location, not on each campus this year. I do not foresee students attending our screening opportunities, but only using this program for symptomatic exposures. If this happens, will it create a problem?
So a couple of things. So in regards to vendor staffing, Rian, we don't foresee that you should request vendor staffing to sit there and wait for people to show up. Now, if you have tests at your campus and a child shows up and wants to be tested, by all means, you can do that. But to have the vendor staff sitting there waiting for symptomatic or exposed personnel to show up is not the way that this program should work.
Yes, and to, once again, to add to that, if a staff or student is symptomatic, they should not come to school to be tested. They should be going to a community testing clinic or their primary care physician's office to be tested.
Thank you both. I see Diane is typing to Juanita's comment about there's a question around in each box. You might use two. If you get a box of 25, right? You order from a vendor and one is positive and one is negative because you have to do the sample testing. You have to do the quality control. How do you mark that? Typically, and correct me if I'm wrong, guys, you would mark that as an exclusion. And I believe some vendor portals, they'll allow you to mark it to as a quality control test. That's how you would mark it. In a small community, symptomatic individuals may call prior to coming to school. I then will test them in the parking lot prior to allowing them to enter the building. Is that acceptable? And can that be a core of our screening program?
So this is Shannon. That is not considered screening testing. If they are symptomatic, that is diagnostic testing. Again, individuals who are symptomatic should not be coming to school to be tested. They should be going to community sites or their primary care physician to be tested.
Thank you for that, Shannon. Next one, Ms. Karen Williams. Does a test to stay strategy count as a screening strategy?
Yes, ma'am, it does.
Go. I.e. testing those. Okay. Yeah, we already talked about that one. So now let me jump to, please continue to drop your questions in the Q&A, but I see some folks have used the chat feature. Let me scroll up. So how far back am I going here? Can you clarify exclusions? I think they've done that already. We talked about exclusions. If something drops on the floor, if something gets contaminated before you can actually get it in the nose of the person you're testing, then that would be an exclusion. And then sometimes if you're doing a quality control testing just to make sure that they're working, that's would also be considered exclusion. Let me see, Monica Joy, and please continue posting the Q&A feature. Please ask your, okay, yeah. And where did we record? Okay. Your exclusions, they're going to be recorded in your vendor portal. Each vendor portal has a drop down or a place where you can put it in there. I already talked about, just to clarify, this year's program is more screening staff, yes. Rather than testing when symptomatic. Yes, this is more of a screening testing program. Approved for staffing means that you've applied in the application, indicated that you want to staff and support. That's the first piece. And the second one, you then have attended only one, you only need to attend one of the mandatory staffing trainings, and it's mandatory for those who want staffing. That's every Friday now from 1 to 2. And then you would receive an email saying that you've been given credit for it, and it'll be marked on your allocation sheet, and it'll say a yes under staffing. You'll also be provided a PDF copy of that PowerPoint. We're not posting those recordings, but you do need to attend that, and we track to see who's attended. And you would need to stay the full duration of the training. So I saw in the Q&A that weekly reporting. Okay, Emma, how do you access allocation report? Is it public? Yes, the allocation report is it's on our website, and it's posted every Monday and Thursday. So it's there. Your name will populate once you apply and you've been approved. Your name will appear, and then you will then begin to see the different demarcations on there in terms of what you can, if you have a hold or no hold, and all of that. Please put your stuff, please put them in Q&A because I'm about to switch back over there. We have carryover tests. Do we still have to report those tests? Yes. You still, I've answered that already, but earlier, if you have carryover tests from last year and you don't participate this year, you still are responsible for reporting those tests because those tests were still funded by this grant. Expired tests, and I'm going to let one of my dishes colleagues jump in here. you report your expired tests once they've expired in the TSRR form. Now, in the inventory report, you're letting us know they'll be expired by December, but once they've expired, that test services and receive report form, you report your expired tests there. Please jump in, Dishes, if you want to further clarify or add on to that. Okay. If we don't opt in this year, can the test be used? Yep. I answered that about the leftover test from last year. If you don't apply for this year, I recently got an email link to register for reporting tests. Is this an approved new reporting system that replaces? We have GenBody. So I don't work directly with the vendors. Dishes does, and so I'll lean on them to answer this. I'll give a general statement. If you're working with Achieve Health this year, they have switched over their reporting system from Crisis Go to a new reporting system. So if you're working with them and they've sent you an email link or something notifying you of the new reporting requirements for that vendor, Achieve Health, then yes, that's what they're doing. They're notifying you and letting you know that it's switched. So only the platform has switched, but the reporting requirement is still the same. You still have to report what you've used, the number of positives and the number of exclusions. If anyone wants to jump in on that, feel free from Dishes. All right. Yes, Achieve changed from Crisis Go to Simple Report. So you will see that change. Is there a template for testing plan? Yes, if you go into the application, if you go into our guidance document, we provide you somewhat of a template. And then if you click on the link, it goes to the CDC website and it lays out what a screening testing plan should consist of. You do have to reapply this year. If you want testing for this school year, doesn't matter what you participated in the past, you must apply this year because we have a new set of requirements, as well as we need updated information in terms of contact information. So yes, you do have to apply. Permission slips, they will be put on our website today, but because we need to switch over the link, and that's just an oversight on my end. If you were to go to our website, and let me actually do that now. Let me go back a slide or two, just so I can show you where it is. If you were for permission slips, let me just go to our website here. So if you were to go to our website, COVID-19 testing, if you go back to, let's go to 2020, should be in 2020, 2020, 2021 tab. If you go to the bottom, and we're going to switch this over within the next 24 hours. If you go under here, you'll see some different templates that we have for you about parent communication, staff communication. We also have permission slips right here. We have a sample in English and we have a sample in Spanish. And we have an annotated version that lets you know what each part of it should be about. Now, this is just an example. We'll move this over, but it kind of lays out for you. And then if I were to go back, you can, I'm gonna go back there. You can download it because we made it as a Word document so that you can then, oh, wow. Let me stop my share here. All right, there we go. Okay. You can see it, and then tweak it to fit your school's system specificities. So you can download it and then change what you need to change, put your logo and what have you there. So it is on our website there. So that's what that would be. Let me go back to our, here we go. And then I'm gonna skip to the end here. Well, I'll continue to answer questions. Let me see what else is on here. So I answered permission slips. Can non-expired tests be returned? No. So what we're saying is to keep those tests and to use that for screening testing, or if you have an outbreak or a staff or student becomes symptomatic at school. And that's also in our FAQ. This presentation will be available. PDF version will be uploaded along with this recording. Can we go over what is the other application for Houston schools? So what you'll need to do is reach out to the Houston Health Department, and I'll put a slide in here for that. Let me skip forward. They will go over that. That's a whole separate piece, and we don't manage that. The Houston Health Department does. But if you were to go You can email them and they will connect with you about the specificities of that program. They also already have an FAQ available. And so if you just go ahead, I'll keep this on screen so that you can at least write down this email address, or you can go to their website. Please clarify, do we randomly pick staff to screen from different campuses, or do we just use the same group each time? I'll give a suggestion and let other folks jump in. It would be great if it's targeted, meaning that you say, okay, on Monday, we're gonna test all of the 12th grade teachers, right? Or we're gonna test our high school teachers. And then next week, we're gonna test our middle school teachers or just this grade level teachers. So that would be one approach that you could do it, in terms of that you've planned it out who you're going to test. And it's a group of folks that you can really identify where there might be folks that are asymptomatic but might still have the virus. Are we allowed to set up testing area to bring in students or staff from home that are symptomatic to test? So I'm gonna allow our dishes folks to answer this. We got about only about 3 minutes left, so let me move quickly. Are we allowed to set up testing area to bring students or staff from home that are symptomatic to test, so that they are not out of the expense of testing elsewhere, so they don't have to come out of pocket? Shannon, did you or Diane want to answer that? They basically want to know, can they set up a site for symptomatic folks to come and be tested? So I'll jump in and say this, and then they can go. You can do that with other funding, but for this funding, that would not be a part of the screening testing, because if they're symptomatic, then that's not a part of the screening testing program. But if you have other funding and you want to set that up, that's fine, but that would not be allowed with this screening testing program. Do you want to jump in or add anything?
Nope, that's exactly what I was going to say. I answered that question, and that's exactly what I was going to say.
And can you use, you can use another source of funding. This is just one option. This is not mandatory. Folks have ESSER funds. You might have other local funds you can use for your testing piece. That's fine. Or you can use this funding to run alongside another program. You won't mix and mingle the things, but let's say you want additional funding to test those symptomatic people, or you want to test parents or whatever. That would be another program that you yourself as a district sets up, but that would not be a part of this program. And these testing resources cannot be used for those programs because they will be separate, but you're more than welcome to do that if that fits the need of your school community. All right, I'm going to jump into here. How long does it take to receive a response from your application? You should get it within a few days, a couple of days of it. If you don't see something, for instance, just email us. Please clarify. One pick, one sample of okay. I showed you what the permission slips will be. We're going to move that over to the current website, but it's under the 2020-2021 tab. So you're saying that we have tested our student staff, but if they are not school, we cannot use a test to diagnostic testing. We have to direct them to outside. Yes, I have a lot of families who will not be tested. I think offering what we have greatly benefits our community. And I think, okay. We stress parents that if a student, this will be the last question. We stress to parents that if a student is sick, not to send them to school, great, but if parents still send a kid to school, close testing sites in 22 more miles away. So long story short, I'll say this. You can only do what you can do. You want to stress to parents and families, don't send symptomatic kids to school. But if they do, and you discover that they're symptomatic, then yes. But if you start to see a pattern that folks are just sending kids to school that are symptomatic, then you need to address that, because we want to keep the integrity of this grant. It is for those true, you didn't know they became symptomatic, or it's an outbreak at the school. With that said, it is now 10:30. We have these questions. We will be able to pull it. We can answer offline or direct to COVID case. Thank you all so much for attending. We know there might be a lot more questions, so we will answer them individually, but thank you all. We're looking forward to supporting you throughout this school year if you choose to participate, and just have a great year. We'll be talking and be in touch soon. Thank you. Bye.